My name is Allison, and I live in San Francisco, California, and I've been diagnosed with idiopathic pulmonary arterial hypertension since 2015. When I was diagnosed 9 years ago, everyone kind of just thought I was lazy and overweight, just kind of tired all the time. It just became my new normal. However, at that point, I had difficulty walking to get my horse, I had difficulty walking to my car, I would always need long naps after school. I had every test done under the sun and came out with my diagnosis of idiopathic pulmonary arterial hypertension. I was immediately started on infused and oral medications and actually had an almost cardiac arrest during that hospitalization due to how sick I was. The initial therapies I was started on actually did a really great job at treating my PAH. It was just a lot being attached to something 24/7. I brought up to my physician that I've heard about this TYVASO DPI. He thought about it for a bit and chatted with other physicians and decided it wouldn't hurt to try. I met with a nurse from the specialty pharmacy and we started the medication titration. I started with 16 micrograms and quickly increased to 64 over the span of a month. When I started TYVASO DPI, I had coughing, and over time it has gotten significantly better as I learned how to inhale a little bit better and work through these side effects. When chatting with other patients about the TYVASO DPI, I always say that all of the medications that are associated with PAH come with side effects, and it's something that we work through and get through. With this disease and these medications, I feel like everyone's experiences are very different. The great thing about the TYVASO DPI is it's packaged into daily doses. So there's 4 cartridges in each blister package for the day. I can throw my daily amount of cartridges in my backpack along with my inhaler device. It only takes less than 30 seconds of my time to take the dose and continue on with my day. Before I was diagnosed with PH, I had difficulty walking to even get my horse. And over the years, I've been back and forth between going horseback riding and taking a little bit of a break. Unfortunately, I found my passion for horseback riding again. After my diagnosis, I started school as a biology major. I started shadowing my amazing nurse practitioners that took care of my illness. They truly inspired me, along with all the bedside nurses that took care of me in the hospital, to finally pursue nursing. I love working in the pediatric cardiac ICU. It's incredibly rewarding working with these patients and their families and being able to be a part of their journeys like the many nurses that were a part of mine. When chatting to other patients about starting a TYVASO DPI, I always feel like it is worth trying. It's just given me the ability to do all of these things I wouldn't even imagine be possible 9 years ago.
What are TYVASO and TYVASO DPI? TYVASO, treprostinil inhalation solution, and TYVASO DPI, treprostinil inhalation powder, are prescription medicines used in adults to treat pulmonary arterial hypertension, PAH WHO Group 1, which is high blood pressure in the arteries of your lungs. TYVASO or TYVASO DPI can improve the ability to exercise. Your ability to exercise decreases 4 hours after taking TYVASO or TYVASO DPI. It is not known if TYVASO or TYVASO DPI is safe and effective in children under 18 years of age. Important safety information. Before you take TYVASO or TYVASO DPI, tell your healthcare provider about all of your medical conditions, including if you have or had previous bleeding problems, have low blood pressure, or if you have asthma or chronic obstructive pulmonary disease, COPD. If you are pregnant, plan to become pregnant, or are breastfeeding, tell your doctor. It is not known if either product will harm your unborn baby or pass into your breast milk. Tell your healthcare provider about all of the medicines you take, as either product and other medicines may affect each other, especially medicines used to treat high blood pressure or heart disease, or that decrease blood clotting, anticoagulants, water pills, diuretics, gemfibrozil, Lopid, or rifampin, Rimactane, Rifidin, Rifamate, Rifider. Both products can cause serious side effects, including low blood pressure, systematic hypotension, and bleeding problems, especially in people who take blood thinners, anticoagulants. The most common side effects of both products are cough, headache, throat irritation and pain, nausea, reddening of the face and neck, flushing, fainting or loss of consciousness, dizziness, diarrhea, and shortness of breath. Like other inhaled prostaglandins, you may have trouble breathing after taking TYVASO or TYVASO DPI. because it may cause the muscles around your airway to tighten, bronchospasm. These are not all the possible side effects. Call your doctor for medical advice about side effects or if you have trouble breathing. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about TYVASO or TYVASO DPI, talk with your healthcare provider. Please see full prescribing information for TYVASO or TYVASO DPI, instructions for use manuals for TD100 and TD300 TYVASO inhalation system, and TYVASO DPI inhalation powder, and additional information at www.tyvaso.com or call 1-844-UNITHER, 1-844-864-8437.